So today I'll be demonstrating how to do a bed bath, and then after that shampooing, oral care, followed by a back massage. So when you first enter the room, you see the patient. You first check at the patient's charts to identify any problems, medication, or any limited movement. So once you verify those, you will then identify yourself, including the patient. So good morning, sir. My name is Maran Zhang, and I'll be your student nurse for the day. So may I know your name?
My name is Howard Sumagang.
May I know your age?
I'm 56 years old.
And when is your birthday?
June 7, 1969.
Okay, so after that, you then explain the procedure to the patient. So, sir, today I'll be doing a bed wash, and then after that, shampooing, followed by oral care, and then a back massage on you. Is that okay?
Okay.
Okay. So after that, you will then provide the patient some privacy. So you close the curtains, close the door. There's curtains here on the bed. You also need to shut them. So after that, you then proceed with hand hygiene. Alright, sir, so I'm going to be starting with a bed wash. So in this scene, bed wash, first we need to replace the blanket with a bath towel. So you place the bath towel over the patient first. Then after that, you remove the actual blanket underneath. Any used clothes or used blankets, you need to put them in a plastic bag or in a basket in order to avoid contamination. So, I'm just gonna put it right here. And then after that, you need to fill in your bucket with water, and then you grab your wet towel. And then you start. So we'll be starting on the face first. So right here with a wet towel, we will be wiping the patient's forehead like this, and then the cheeks, the ears, and then behind the ears, underneath the chin, including his neck. After that, we will start drying his face with a dry towel. So we dry the forehead, the cheeks, underneath his chin, the neck, the ears, behind the ears, his nose. And then after that, we will proceed to his arms. So his arms, we need to put a waterproof pad underneath. So right here. Thank you. And then we proceed to scrub. The arm, we will scrub the arm, and then the hands, the fingers, and then after that we will dry them with a dry towel. And then after that, we will do the same thing to the other arm. So we put a waterproof pad underneath, and then we wipe them with a wet towel, and then we dry them. After that, we will then proceed with the chest and the abdomen. So again, with a wet towel, we will We will keep the bath towel on him in order to safety his privacy. So after that, we will wipe his chest, his stomach, and then again we will dry it with a dry towel. And then after that, we will have the patient turn over to the other side so that we can also wipe his back. So sir, may I have you turn on your side, please? Okay. So over here, we will put a waterproof pad underneath him too. And then we will start washing his back. So over here, we scrub and all the way down. And then after that, we will dry it with a dry towel. And then remove the waterproof pad. And then have the patient turn back around again. So sir, I'm going to have you turn back around again. So after that, we'll proceed down his legs. So right here, we will only expose one leg at a time. So we will start with the right leg. So we will only expose this first. The waterproof pad, put it underneath his leg, and then start scrubbing it. So scrub it with a wet towel from the foot, the legs, the thighs, including his crotch area. After that, you dry it with a dry towel, and then you do the same thing to the other leg, his left leg. So again, waterproof pad underneath. You scrub his foot, his legs, his thigh, and then the crotch area. So after that, you remove the waterproof bed pad, cover his legs again, and you're done with the bed washing. Next, what we're going to do next is the shampooing. So sir, I'm going to start shampooing your head, okay? So, of course, first things first, we will put a waterproof pad underneath his head. Okay, lie back down. That way the water won't end up getting soaked in on the bed, including we will be putting a bucket underneath too so that the water can flow down. Okay, lie back down. Alright, so over here the first thing you need to do is to check the head for any lesions, dandruffs, or any redness or injury. If there's none, you proceed to wet his scalp, his hair, with a bowl full of water. Then after that, take the shampoo and then pour it in your hand. You rub them together, make sure you get a good amount, and then after that you start scrubbing his hair. Make sure you get all the places, and then after that, you will then rinse his hair with water until there's no more soap or shampoo left. After that, you're gonna dry his hair with a dry towel. And then once that's done, you remove the waterproof pad. Okay, I got it again. Yeah. Note to yourself that we're using a different dry towel for every single drying. So after that, we're going to proceed with oral care. So in oral care, I'm going to have my patient sit upright. So sir, I'm going to have you sit down, okay? 1, 2, 3. Okay. Make sure you put a towel or a waterproof pad will do on his chest to prevent any water from going down his body. Okay, so after that, you have the patient rinse a cup of water, and then once he's finished rinsing, He will then spit it in a container. Then after that, you grab a toothbrush and toothpaste. And start brushing his teeth. So when you brush a patient's teeth, you start with the front part first. So circular with small movements up and down. Same with the sides, circular movements up and down. The other side too. And then after that, the inside. Make sure you get all of them. And then of course the tongue. The tongue is very important. So make sure you also brush the tongue. After that, have the patient rinse a cup of water again, and then have him spit in a container, and you're done with oral care. Take off the waterproof pad, and then have the patient lay back down again. So the last step will be massaging. So in this case, you're gonna have the patient turn over all the way. So sir, I'm gonna have you turn over to your stomach. Okay. So we will only be exposing his back. So after that, grab a lotion, you rub your hands together to get a good amount, and then you start at the bottom by pushing it gently and then start rubbing it in a circular motion, and then after that you make it all the way to the top. So start at the bottom and then here at the middle, again gently circular motion, and then right here at the top again push it gently in a circular motion. And then you pull down the shirt or cover him up again, and then you have him turn back to his original position. So sir, I'm going to have you turn over again. So after that, you're going to be replacing the bed towel with a brand new bed sheet. So imagine this is a brand new bed sheet. So again, place it on top of him. Make sure he is completely covered up. And then after that, you will then remove the bath towel. Remove the gloves. And then you're done. Okay, sir, we're finished. Thank you for your cooperation.
Come.